Sclerosis is a very common structural cause of temporal lobe epilepsy. Structural meaning there is structurally something wrong with the brain that is creating the seizures. The seizures that come from mesial temporal sclerosis are focal seizures, and they're generally temporal lobe epilepsy related. You see it here on MRI. The red arrow is what shows the abnormal mesial structures. Mesial structures just means deep parts of the temporal lobe. You see how this is small compared to the juicier side on the other side? Well, we call this a sclerotic temporal lobe. And sclerosis basically means something is smaller and thicker, and that's the medical term for it. So mesial temporal sclerosis means this area of the temporal lobe that's deep inside is thicker and smaller. Seizures caused by mesial temporal sclerosis are pretty stereotyped, meaning you'll have some strange sensations such as auras, deja vus, changes in behavior or emotions. You can have muscle spasms, and ultimately you can have the big tonic-clonic seizure. It's also very stereotyped for this area to have olfactory hallucinations and taste hallucinations, so you can smell and taste usually really nasty and noxious stimuli. Sometimes people are born with this. Sometimes this happens later on in life. Sometimes it happens really early in life. And by that, I mean, when you have febrile seizures or seizures as a baby with high fever, this area is really sensitive to those seizures. So even if your brain is born structurally completely normal, having that fever in childhood and seizure can create this, leading to lifelong seizure. This is diagnosed with an EEG and MRI studies like the one we're looking at. The treatment is with anti-seizure medications. This is actually very amenable to surgery, meaning people do well, about 60 to 70% seizure freedom after surgery. You can either go in or take this part out, or you can do laser ablation where you take a little laser and do ablation therapy. The one caveat being this area of your temporal lobe is super important for memory, so you might have to do something called a WADA test, which is a memory test to make sure the other side can compensate.